I'm Kevin Dedner, the founder and CEO of Henry Health. Henry Health is a mobile app that provides self-care support and culturally sensitive teletherapy for Black men. We start from this place of understanding that Black men have the lowest life expectancy of any population. And when you start to unpack that, what we begin to understand is that a big driver of that is unmanaged stress and untreated mental health issues. So I have a public health background, and about 5 years ago I was working to grow my public health consulting practice company, supporting clients like the Robert Wood Johnson Foundation, the National League of Cities. I lived like in this place where I was analyzing public health problems all the time. And it was the George Zimmerman verdict that literally gave me a bad headache. And after my headache finally went away, I started to think about the stress associated with being a Black man. And I dug into the literature, and within a few days of doing a deep dive into the literature, I came to a conclusion that unmanaged stress and untreated mental health issues were a silent killer for Black men, and that we hadn't talked a lot about it in public health. So in that moment, I really wanted to do something about it. I literally bought the domain Was Killing Black Men, thinking I'd write a book. The book is still in the works. I tried to get my clients to launch a national survey to start measuring the emotional and mental health of Black men. But I really couldn't get any traction around all of the tangible things that I tried to do to satisfy my thirst to do some work in this area. And so I went on with life, and pretty soon life began to take a downward spiral, and the stress became overwhelming for me. And that's when I fell into a period of depression. And I saw several therapists before I could actually find a therapist who really could establish an alliance with me and understood me. After that, I started what I thought was like rebuilding my consulting practice and rebuilding my life when my co-founder reached out to me and asked me would I be interested in doing anything in digital health. And in that moment, that was October the 24th of 2017, in that moment, all that I had personally experienced, but all that I had come to understand intellectually about stress and mental health all made sense. You know, what really keeps me driven is the connection I have to men when I share my story, because what I find is there's often a man who's waiting for me at the foot of the stage, or perhaps he may email me days later and he'll tell me how the story resonated with him and how he has struggled with anxiety or depression, and he did it quietly. And that is a real driver, because what it says to me is that we're addressing a need that hasn't been surfaced in a way that people have felt comfortable asking for help. And so I think that there is a demand for a product like Henry Health. And I'll go a step further. I think that there is a demand and a need for culturally competent digital health tools across the board. And I think that the unique thing for Henry Health is that, and maybe our contribution to overall public health, is that we can help to develop a framework of delivering support and teletherapy in a culturally competent way through digital health. But our moonshot at the company is to increase the life expectancy of Black men by 10 years within 25 years. And that's an audacious goal, but it's a goal that, we know that we won't reach alone, that we need to create a movement around adding not only quantity but quality to the lives of black men. And so for me, what success looks like, or what the goal is that we could create a whole movement around what it means to be a healthy black man, and that Henry Health would not only be a driver of that, but that Henry Health would have an identity in that it would be a brand that's synonymous with what it means to be a healthy black man.